6 dangerous signs warn of cardiovascular disease that require immediate hospitalization. The sixth sign affects up to 99% of Americans without them even knowing it. The first sign is shortness of breath. We often associate shortness of breath with lung issues, but in reality, when there is a heart condition, shortness of breath can be one of the first symptoms to appear. The heart functions as a pump, transporting oxygen and nutrients to nourish the body's organs. When the heart is not working efficiently, the amount of blood supplied to the organs decreases, leading to reduced oxygen delivery to the tissues. The brain detects this lack of oxygen and triggers a reflex to increase ventilation, causing you to breathe faster and feel short of breath. In the early stages of heart failure, shortness of breath typically occurs during exertion, such as climbing stairs, exercising, or carrying heavy loads. As the condition worsens, shortness of breath may occur even at rest or during light activities. Additionally, heart failure can cause fluid to accumulate in the lungs. Normally, blood is pumped from the heart to the lungs for gas exchange. But when the heart weakens, blood backs up in the lungs, increasing pressure in the pulmonary blood vessels. Fluid from the blood vessels seeps into the lung tissues and may even flood the alveoli, hindering gas exchange and worsening the symptom of shortness of breath. The second symptom is angina, an emergency condition related to coronary artery disease, causing myocardial ischemia and leading to chest pain. The coronary arteries are the blood vessels that supply the heart muscle. When these arteries become narrowed or blocked, often due to atherosclerosis, the blood flow to the heart muscle is reduced, causing myocardial ischemia. Angina is the manifestation of the heart muscle being deprived of oxygen, lacking the energy to function properly. Angina is often described as discomfort, pain, heaviness, squeezing, or pressure in the chest, usually centered behind the breastbone. The pain may radiate to the left shoulder, left arm, neck, jaw, back, or upper abdomen. Accompanying symptoms may include shortness of breath, sweating, nausea, dizziness, palpitations, and a racing heart. Angina typically occurs during physical exertion, intense activity, stress, emotional upset, or exposure to cold. However, as the condition progresses, pain may occur even at rest. The third symptom is sudden fainting, a temporary loss of consciousness often related to arrhythmias or carotid artery disease. Fainting occurs when blood flow to the brain is reduced, temporarily depriving the brain of the oxygen and glucose it needs. Arrhythmias are one of the common causes of fainting. The normal heart rhythm is regulated by the heart's electrical conduction system. When this system malfunctions, the heart rate may become too fast, too slow, or irregular. These disturbances reduce the heart's ability to pump blood, affecting blood flow to the brain and causing fainting. Additionally, carotid artery disease, particularly carotid artery stenosis, can also lead to fainting. The carotid arteries are 2 large blood vessels on either side of the neck that supply blood to the brain. When these arteries are narrowed, blood flow to the brain is impeded, especially when the person turns their head or neck suddenly, which can cause transient cerebral ischemia and lead to fainting. Other causes of fainting may include orthostatic hypotension, hypoglycemia, anemia, and dehydration. The fourth sign is edema, a common symptom characterized by abnormal fluid accumulation in the body's tissues, causing swelling in areas such as the legs, arms, and face. Edema can be caused by various conditions, including kidney disease, cardiovascular disease, liver disease, or pregnancy. In cardiovascular disease, heart failure is a common cause of edema. Heart failure occurs when the heart can no longer pump blood effectively. When the heart weakens, blood backs up in the veins, increasing pressure within the vessels. Fluid from the vessels is pushed out, seeping into the interstitial tissues and causing swelling. Edema due to heart failure often appears in the lower parts of the body, such as the ankles, feet, and lower legs. In addition to heart failure, edema can also be a sign of kidney disease. The kidneys filter blood and eliminate waste products from the body. When the kidneys are impaired, their ability to filter blood and regulate fluid balance is affected, leading to fluid retention and edema. To identify edema, You can visually observe or press on the swollen area. If pressing on the skin leaves a dent that takes time to return to normal, it is a sign of edema. The fifth symptom is cyanosis, especially when accompanied by intermittent claudication, which is a concerning symptom that may indicate lower limb vascular obstruction. Vascular obstruction occurs when blood flow to the legs is impeded, reducing the oxygen and nutrient supply to the tissues. Cyanosis is the bluish discoloration of the skin, usually appearing on the extremities such as the toes and feet. This occurs because blood becomes congested in the capillaries, reducing the oxygen content in the blood, causing hemoglobin to become deoxygenated, turning blue. Intermittent claudication is pain that occurs during physical activity, especially walking, and gradually subsides with rest. The pain is usually localized in the calf but can radiate to the thigh or foot. The cause of the pain is that during activity, muscles require more oxygen, but due to the obstructed blood vessels, they do not receive enough, leading to ischemia and pain. Lower limb vascular obstruction is often caused by atherosclerosis, a process in which plaques form on the arterial walls, narrowing the vessel lumen and obstructing blood flow. Risk factors for atherosclerosis include hypertension, dyslipidemia, diabetes, and smoking. Finally, intermittent claudication, a typical symptom of peripheral artery disease, is pain that occurs during physical activity, especially walking, and gradually decreases with rest. You may feel pain, heaviness, fatigue, or discomfort in the calf, sometimes radiating to the thigh or foot. The cause is the narrowing or obstruction of the lower limb blood vessels, reducing the blood supply to the muscles during activity. When you rest, the muscle's oxygen demand is low, and the limited blood supply can still meet the demand. However, during activity, the muscles require more oxygen. At this point, due to the narrowed blood vessels, the blood supply is insufficient, causing ischemia and pain. When you stop to rest, the oxygen demand decreases, improving ischemia, and the pain gradually subsides. The most common location for intermittent claudication is the calf, but it can also occur in the thigh, foot, hip, or buttocks, depending on the location of the affected artery. The intensity of the pain can vary from mild to severe, ranging from discomfort and fatigue to sharp stabbing pain or cramps. The distance one can walk before experiencing pain also varies among individuals. Some may feel pain after only a few steps, while others can walk a long distance before symptoms appear. Thank you for watching Dr. Parker's video. To avoid missing future videos, you can subscribe to the channel. See you next time.